the committee that runs the wine and food and helpers selected this project as the beneficiary of our efforts this year. The project itself is amazing, and I ask your attention to Richard Siegler. Richard, welcome.
Thank you very much, President Michael. Thank you, all of you, for having me today. My dear colleague and our project leader in Uganda is the Pest District Governor, John Magezi, and he has a medical appointment right now, and he said, I'm going to really try, but it wasn't easy to get. So John from Uganda sends his regards and thanks as well for your partnership. So I'll just briefly share a little bit about what our organization does at Bulamu and the maternity and newborn health global grant that we've been working on with about 10 Rotary clubs now. And so that we're, of course, very excited about. And then I'll have some time for questions. Let me start by sharing my screen, and I'll send you some of this information later, but I want to start by showing you just a few of the patients that our team treats at Bulamu Healthcare. And this is a page with patient profiles and a few stories of our work with Rotary. And I share this not just because it's important, that we recognize the people we serve, but also because these are patients who our team and myself learn a great deal from. And one of the very important patients profiles is a mother who needs some help to give birth safely. In this case, Jane had a negative experience with a prior birth where she didn't have the money for her care after she gave birth, and they sent her away until she came back with the money, and then they finished taking care of her. And fortunately, she wasn't in more duress, or she would have been in a very difficult situation. And then when she came in for her second born, the team of my organization, Bulamu Healthcare, was present. And one of the things we do for mothers who are coming into our partner health facilities is we make sure that they can have a safe experience and a dignified experience without having financial difficulties. So in her case, she just needed a little support for surgery supplies to have a C-section. And in this case, our team provided the C-section. But when we finish directly treating patients with a partner facility, we leave behind systems that ensure the facilities staff has what they need to provide that care free of charge with our sponsorship. And so this is just to show you one of these patients we exist to serve. And now let me get into a little bit more of the background. So everything that I share is with the patient's permission through a standard called informed written consent. That's very important to mention. And everything you see is the work of teams, primarily led by Ugandan managers and doctors and nurses. And then I, based in Chicago and a member of Rotary in Chicago, am very lucky to get to support these teams to do what they do. And my organization, Bulamu, is a US nonprofit, though this particular work, the funds will be moving through Rotary because of the matches that our support can generate at district and the Rotary International Foundation levels. So you heard my background. Let me just tell you a little bit about Bulamu Healthcare's background. We were started in 2016 as a US nonprofit by a retired IBM executive and a Ugandan nurse. And before the pandemic really accelerated, our model was a week-long medical camp. And as in our last week-long medical camp, we treated 17,000 patients with a staff of about 300 Ugandan doctors, nurses, midwives, and support staff. And that cost us about $5 per patient. So this is what we are doing in the olden times. And let me just share with you a little bit of what we have done since. And this is all work that has taken place since March of 2020. I will share this again, but I just wanted you to get a little sense of what we are very fortunate to get to do in Uganda. Now, let me just tell you a little bit about how. I will send on our videos and these patient profiles, and our annual reports and our audits are all online, just FYI. Our mission is to treat the sick and strengthen the health systems that need to serve Africans in need, and too often are failing patients throughout Uganda and much of the continent. We have a budget of about $1.6 million this year, and we organize teams that treat patients, Ugandan doctors, nurses, and midwives, which means they speak the language, they are licensed in the country where they are practicing, and they are lower cost than traveling teams. And we can ensure through our culture and our management that the bottlenecks that would prevent a low-income patient from access to care are removed. And then when we've modeled high-quality care in public health facilities, we then move our teams on and we provide systems to partner health facilities. And we currently provide systems to improve healthcare for the poor to a bit more than 260 partner health facilities. And we will serve a bit more than 1 million patients to have better standards of care at these partner health facilities this year. And so our goal is to scale nationally in Uganda for the systems that we prove work and can be scaled at very low cost. And then we want to share our systems with more countries over time, because when it is needed in Uganda, generally it is in most countries in sub-Saharan Africa. So since 2016, we have altogether treated a bit more than 325,000 Ugandan patients, and that includes about 10,000 surgery patients. Our cost for a general medicine or maternity patient is around $6 per patient because of this volume and working with local staff. And our cost for a surgery patient through our main program is about $163 per person. And a statistic we're very proud of is we have supported, just since June 2020, a bit more than 10,500 babies to be delivered, about 880 through C-section. Our surgery program is robust. We work with the leading Association of Surgeons of Uganda, and we jointly operate week-long surgery programs from patients identified from our general medicine program. And we did a survey last year of about 350 patients, and 76% of them had waited 3 or more years for the surgical care we provided. Many of them had waited a decade or even in some cases 2 or more decades to find surgical care for some of the conditions that you saw. So I will just briefly suggest that when it comes to the question of how can we transform healthcare for the poor, the answer is one step at a time. We just have to find incremental improvements and learn from that process in order to continuously improve. And I'll give an example of that, which is our first Rotary grant that is now about 95% complete. It started a little more than a year ago, and with support from clubs in California, Uganda, and elsewhere, we raised $91,000 to provide vital signs equipment, what you need to take blood pressure and weight and pulse ox, and among others. And when we provide those devices, we have to also provide refresher training to the staff at the health facilities, because if they don't have the devices, and it's been a few years, it is, in order to work best, the equipment needs to come with some training, which is pretty low cost. And so this $91,000 global grant is now almost complete, will wrap up in the next couple of weeks, and has passed 125 Ministry of Health facilities that have received the amount of equipment they need to take vital signs for their patients. And at the 125 facility mark, those partner health units treat about 900,000 patients a year. So for about 10 cents per patient in year one, we are able to introduce a standard of care thanks to Rotary support and matches from districts and the International Foundation. And obviously that work could scale nationally. Uganda has about 3,200 Ministry of Health facilities, and we've already provided this to about 300 of them. So we could take it to the other 90% of the country at a price that is not, it's not zero, but it is very reasonable for the number of facilities and the number of patients that it would serve. So with that background, let me tell you a bit about our new global grant that we are partnering with your club on, which is called Model Districts for Maternal and Child Health in Uganda. About 7 months ago, PDG John, at the time the district governor John, and I were talking about this Vital Signs grant was running itself, and we said, what are we going to do next? And we said very quickly, let's work on maternal and child health. Uganda loses about, for every 100,000 women who give birth, about 350 of those women pass away. And that's unacceptably high, and far higher than in the US or Europe. And for every 1,000 newborns who are born, about 40 of them pass away, which is obviously a crisis. It is, we think, the leading cause of death in the country. And so the need was very clear, and we liked the Vital Signs grant, and we said, well, why don't we, adapt that model for maternal and child health needs? And so my organization provides currently a few systems for to improve maternity care and newborn care. We support patients' emergency transport. We make sure surgery supplies are so that C-sections can take place at community hospitals. And we provide patient treatment forms, which for the maternity process are important, because the best ways to make maternity care and newborn care safer are increase the number of expectant mothers who are getting prenatal care, so that complications can be identified earlier for more patients, and so that patients give birth at professional facilities with trained birth attendants. Currently, about 40 to 50% of women in Uganda give birth at home because of financial obstacles and a lack of confidence in the system, the facilities that are waiting for them. So we need to make sure women are getting prenatal care and building confidence in their host facilities and going to them to give birth. And once the mother is giving birth in a safe environment, the baby can receive crucial care in the first minutes of life, which is where Rotary comes in. What Rotary will fund through this grant that my organization does not have the budget for yet is upgrading the maternal and child health equipment at partner health facilities, about 80% of the budget, and then clinical training, refresher training for primarily nurses and midwives and some doctors in newborn care. And we're going to use a couple of trainings, but the main one is called Helping Babies Breathe. It's came out of the American Association of Pediatrics. It essentially trains the clinician in this is what works best, which is leave the mother for a minute and make sure the baby is breathing and suction the baby's airway, which often is necessary to get some healthy breaths going. And there is more to it, but it's focused on let's make sure the baby is breathing in the first few minutes of life. So this approach with these 5 systems, we have a couple of important goals for it. One is we are going to provide this to 63 maternity health facilities and in 6 partner districts, all of the maternity facilities in these counties or districts in Uganda. And they deliver about 100,000 babies a year. So we want to work at some scale to begin with, which a $200,000 or slightly more global grant will allow us to reach. Our goal is to reduce the rate of maternal mortality and newborn mortality. And this is it's an ambitious goal, but we will, with this number of newborns and mothers served, we will be able to measure if it works, and we will adjust until we deliver this outcome. And when we know that we can provide a better environment with better health outcomes for this number of patients, we will apply for programs of scale, which is a $2 million once a year funding from the Rotary International Foundation, and it would let us take this work to approximately 40 or 50% of Uganda's Ministry of Health system. So we have raised just around $100,000, and we need pledges of approximately another 30 to 40,000. There are a number of clubs where they've said, we're very interested, and we'll get through our vote or our fundraising activity, and then we will let you know the exact amount. So we are close, but still have a little bit of legwork to do to share this with a few more clubs and finish up the fundraising phase. We are hoping to support to have the funds come in January and launch the program in February, so that it is largely implemented by next August, when the programs of scale application is due, if it follows the same timeline as this past year. So I will just tell you, I was delighted. Some of the best news I've had this year, when Michael called me and said, we're interested in making this maternal and child health project the beneficiary of our upcoming fundraising event. So I think you have a sense of what Bulamu does and what my team and Rotary clubs in Chicago, which is the partner on this, and California and Florida now, and multiple clubs in Uganda are working to do specifically to show that maternity care, newborn care can improve at a relatively low cost, and then we can have a program we test to prepare for programs of scale. So I do appreciate help with fundraising and fundraising, anything in between. So I will send you something if you would like to share this. But for now, let me pause and hear any questions. Thank you all very much.
Thank you.
Thank you, thank you. Very much, thank you very much. Okay, any questions?
Because we have two physicians in the attendance, Mr. Tim Bush here on site, and Dr. Carmen Ortiz Kocher. She asked some questions in the chat. Therefore, allow me just to ask her to ask those questions directly to the doctor. Not to the doctor, to the speaker.
I see the questions from Dr. Ortiz, and if I could respond, we do testing through the labs of our partner Ministry of Health facilities. And sometimes when their labs are run down, we'll bring in what they need to make them operational. Just to give you a little context, when our surgery patients need labs, very frequently they need to be referred to labs in urban centers. So a rural health facility often doesn't have what our team needs. For example, it might not have an X-ray machine, and our team will send the patients in the screening process for surgery to nearby cities, and typically to private labs. And then the $6 per patient cost is, keep in mind, the facility is built. So we go to a facility that hosts us, and the facility is staffed. The Ministry of Health has doctors, nurses, midwives. So we bring some additional staff and medicines and supplies and so on. But there's a lot that is there to host us. That makes it as leveraged as it is, as low cost. The insight we had, I would say, is that the doctors and the nurses, the midwives, want to do the work they're trained to do. And the patients actually have a lot of confidence in the training of the health teams. So it's a series of systems that are letting everyone down. And the systems can be, at least many of them, can be addressed at fairly low cost. You know, when an operating room is out of surgery supplies 40 to 60% of the time, which is what our partner community hospitals told us in early 21, that sounds like a major problem. It's not minor, but the cost of individual surgery supplies, sutures are $4 for a package of 12. Spinal needles are quite low cost. Gloves are, of course, even cheaper. And so if you're just talking about a supply or two being the
software.
Yeah, can a C-section take place or not? It of course makes sense from our perspective to provide these supplies in advance. And so we have a list of supplies that the facilities order from. We make sure they don't run out of the things they need to do C-sections. And that has supported a bit more than 6,000 patients to have surgery since the start of 21. And the cost on average for those supplies is about $15 a patient. And then, thank you. Are they screening for HIV to provide PrEP therapy to infants? Uganda's HIV program is excellent. It is the program that runs completely differently, and as you would hope, compared to everything else. And that's because U.S. government support funds it almost as a separate operation for HIV and TB. And so I haven't asked in a bit about the PrEP therapy, but I believe the answer is yes, because everything else in Uganda's HIV program runs perfectly. And they went from an HIV rate 20 some years ago of around 25 to 30% of the population to today around 4 or 5%, which is below 5%. An epidemic is considered to be under control in that case. Thank you. Was there another question?
Do the patients donate money?
They don't. We haven't asked, and we've just been focused on, can we make the care available in a way that's dignified and encourages people who might not have very much available, even, $10, $20 to get to a health facility. Can we just try and encourage people to come in and get professional care has been our focus so far. When our team follows up with them, very frequently, they give the team animals from their small farms. And so it's one of my running questions of, well, what happened to that chicken that I see, getting handed over?
How is dinner?
There is another question in the room, Dr. Bush?
So yeah, thanks so much for this beautiful presentation and for the amazing work that you're doing. I really have two questions. The first one is, so you've got the Ministry of Health. That's what percentage of care in Uganda is handled by that government ministry?
What I calculated was what percentage of patients have to go to Ministry of Health facilities, and the difference is of the Ministry of Health provides care for free, but is limited in what they can provide. And then private sector facilities can provide as much as people can pay for. The answer was a bit more than 80% of the population of Uganda can only go to Ministry of Health facilities because of, what they have available to support their care. Thank you.
So in a lot of ways, what you're doing is supplementing and supporting the Ministry of Health activities. Is that the way it works?
Yes, and what we learn when we get a program really functioning well is that it costs less than people would at first expect, when they're used to, maybe designing programs that function in private facilities in urban environments. And so our cost for a surgery patient to support is about $15 a person. To a transport an emergency patient, it's about $30 a person. The MCH equipment, the Maternal and Child Health equipment and the clinical training can all be done for about $200,000 in 63 facilities, because these are things you just provide once and then they run. And we'll leave behind local trainers in each county. So what we're trying to show is that dignified healthcare does not have to, in East Africa, does not have to be extremely expensive, and therefore it can be, these systems can be implemented nationally and beyond, we hope.
Yeah, so I mean, and the numbers, the cost numbers that you quoted in your presentation are just amazingly low compared to what we experience here in the US. So you also mentioned that you used this word systems 2 or 3 times in the initial part of your presentation. So did you just answer that question, maybe, that you're leaving some of these instructions as well as equipment in place after you've been there? But what do you mean when you're partnering with other with these folks and leaving systems behind? What do you mean by systems?
It's a great question, and I use it for brevity, but it's anything that improves care, that is we support, often we design, but is implemented by the existing facility, the existing Ministry of Health staff at that facility. So when we transport a patient, it is one district health team leader in each county or district who has the money on a cell phone account. And then when she gets a call saying a patient has obstructed labor, needs to move from home to this health center for a C-section, she can make one more call, has the funds, and we don't actually want to be in the middle of that because it would cause further delay. So that's one system. Transport, and we've transported through our partners about 1,500 patients since early 21. And then our surgery supplies a second system. We give them a list to the community hospitals, they order from it. Another system worth mentioning is the maternity patient treatment forms, because while it's important for this program to get mothers to come in for prenatal care, in turn increasing the percentage of women who come back and give birth at the facility. The Ministry of Health of Uganda in August actually started a conversation with us where they said, we would like to take these forms and make them our forms nationally. And so everything we do, we've been designing to give to the Ministry of Health of Uganda and then eventually other governments so that it can work nationally. And that's the first time they've said, we want this nationally. So we're in the process of giving them those forms, maternity treatment forms, late this year, early next. But it really looks like that's a system that will be working throughout the Ministry of Health at some point next year.
Very impressive. Thank you.
Thank you for that wonderful presentation. You have,
No, Ellen has a question in the chat.
Ellen Blasi.
Is the program for AIDS and TB from the Global Fund? I don't know the percentage of where the different funds come from. My understanding is a lot of the funding comes from PEPFAR, but I would think that the Global Fund is also involved.
Any other questions?
Thank you.
Okay, thank you, Rupert and Michael, for bringing this great project to be the recipient of our wine tasting. And talking about the wine tasting, Ruben, you have the floor.
Good morning, Rotarian. Good morning. Good morning, Rotarian.
Good morning.
It gives me great pleasure to, number one, acknowledge two sponsors that we have received since last week's report. All right. We welcome Amaranth Bank. All right.
You can't hear, they will not hear you.
Okay. Can you hear me better now?
No.
I want you to talk to the.
There he is. Now we can see you.
All right.
You can see.
So it gives me great pleasure to announce two sponsors. Amaranth Bank came in at $3,000. And Avior Technologies this morning came in at $1,500. Altogether, that takes us within $800 of our goal. So last week we were short, this week we're almost there. I would like to thank Michael for his initiative in researching this project. Last year, I told you this is a project for Rotarians, by Rotarians. This is the example. This is the first time that we participate in a syndicate program with other clubs in a project of scale and magnitude encompassing 60 facilities and benefiting the lives of 100,000 babies a year. So this is what you're doing. And as far as one tasting report, we got the 13 restaurants, we got the 26 wineries, we got the vodka station, we got the music, we got the sponsors, and now we need what? The people. We need the people. So I want you to go through this weekend and support Peter in his Halloween party. But then after that, Monday morning, I want to see you fresh and bushy-tailed selling wine tasting tickets. Thank you for your support.
And since the motto, the fifth of the four-way test, the fifth one is to have fun. You can have fun with Peter this week and then wine tasting next week and keep having fun all the way to the end of the year. Or Michael?
Is there anything anyone needs to know about how to get tickets and pass them on for sale? Everybody's got that.
I think everybody knows how to get tickets.
Yes, but the way it works is you ask me for 10 tickets, you place 10 tickets, you tell your friends, you tell them that they're gonna run out, because they will. And people buy them from you. That's how it works. Okay, so see me after they.
Yes, Michael?
Just so, Peter, so you know, I'm working on a sponsorship for you. It might come after the party, but it is in the works. They haven't, is that his came and I had just transitioned to the new bank, but I am promising you that something will be given.
Oh, thank you.
Oh, and in case and you can hear this.
And Peter, how are your ticket sales?
Yeah,
You said almost sold out?
Well, we, I think we allowed to bring 160, we have 150 tickets sold, so we're almost there.
Oh, okay, so you just have to
Don't
look
bet
for
about
10
count.
friends and bring them over.
Okay, who hasn't bought a ticket for tomorrow? Who hasn't bought a ticket? Okay, we got one.
Larry, yeah.
Karen Ortiz, would you wanna say
We
something?
got 8.
Yes, Carmen, you're mute.
Take two.
You're on mute.
Myra, one.
We got 4.
You can stand on Brandon Boulevard
Yeah,
with that
yeah,
sign.
Oh, my God.
Okay, two comments. One is, I'm going to sponsor and donate $500 towards the wine festival. My company, Island Clinic, towards your $800 that you have pending towards the goal. And number two, can we set up a booth at Peter's event to sell tickets for the wine event towards the second half of the evening? Because I'll volunteer for that booth.
Sure, why not? We support each other.
Yeah, exactly.
Interesting.
One after another.
It's all
Yeah, and then
happening.
I think we sell for something else. I mean, this is what we do. Dominoes for education. So this, it's a chain. So you guys don't have to put all the money with the way to do this is to bring other people's money. So you don't feel like we are taking all your money, even though we are. Okay. And anything else? Any other announcements? Toby, you have anything to say? Mayra, you want to say that?
Yes, I just want to announce that I have transitioned to Emerald Bank. I'm going to be the director there, and it's going to be next to Starbucks where Duncan Fraser was, that space. So I will be the new director there. Hope to see you all there.
Okay, great. And
And you didn't know,
happy dollars.
it's the new bank that's done the sponsorship for.
Yes.
That's right. Peter, you wanna do happy dollars since you're gonna be very happy this year.
Sure.
Oh, yeah.
So let's start with you.
Okay, my happy dollars from the bank, and they go towards the presentation today, which was great. I'm also very happy quickly for this weekend's activities, how the wine festival is going. And I think most importantly, I'm happy that the election is going to be over in about 10 days. Last week, I hadn't met either of the candidates running for mayor. Over the last week, I've met them both. They're both respectful people. They both have the best interests of Key Biscayne, and don't listen to their acolytes who say it's an existential threat if one or the other wins. It's infuriating.
Yes, I agree
Yeah,
with
it
you.
is.
Yeah, it is true.
Yes, my happy dollars, tomorrow. My happy dollars go to the Ugandan project.
Thank you.
Thank you.
Mark?
Mark,
Good morning. I've got some happy dollars. First of all, I've got to pay. Who's getting the money for breakfast? So $3 happy dollars, and I have happy dollars in the bank already for the rest of the year, which is coming to a close. First happy dollars were for fishing yesterday. My good buddy Mark and I caught 2 dolphin, and I cooked them great last night. They wine citrus reduction salt.
Wow.
The other happy dollar is in a couple of weeks, Gail and I are going to Italy on Monday, and Gail's gonna drop me off in Florence where I'm gonna go become an olive picker.
Yeah.
you like it, huh?
Michael.
First, I want to thank Richard, who has been incredibly helpful and cooperative in providing material and data and information. And I want to compliment him on this structure he's created where he's brought what appear to be 15 different Rotary clubs together. More than half in Uganda and the rest in this country. And I want to say how proud I am to be able to come here and show Richard what we did.
Thank you.
Grace?
My happy dollars for Richard and for that program that we heard about today.
Um,
You're next.
Yes, I'm next.
well, my happy dollars will actually go for Rotary and the programs like this, because I think it's so inspiring and brings us hope in a moment where things are so confused, to put it lightly. But also, I'd like to invite you all on November 2nd at 6 o'clock to St. Christopher's Church, because we're gonna have an amazing program. It's a celebration of all souls with the Rotary Requiem, which is magnificent, with outstanding St. Christopher's choir and extra instruments. It's non-religious, it's just a celebration of all souls, so no, all faiths, beliefs are welcome. And I really, really encourage you all to come, because it's gonna be very, very special.
What time?
6 o'clock, St. Christopher's.
And even though I'm out of turn, I'll chime in by just saying that the music is going to be extra special. The choir rehearsed last night. And there will be instrumentation, harp, flute, cello. It's a really special program. So next Wednesday at 6 o'clock. Thank you, Gloria.
That's $10. Okay.
Thank you. My happy dollars are with the band. But I couldn't be more proud of this club. There are so many people here that do so many things that make a difference. Peter, Inez, Steve, myself, everybody else who is basically spearheading a project that is supporting something. You make a difference. Thank you, and I'm proud to be here.
Ludmila.
Thank you. Well, my first dollar, Peter, come over. I'm happy to be here. My second dollar for our speaker, I'm sorry I'm late, but I heard questions and answers and it was interesting. I'm sorry, this is for you. And my third dollar will do tomorrow event. Thank you so much. And I have something for you from Russia. It's a Rotary Club of City of Novorossiysk. They signed it on October 14th with hope for friendship and love. Nina Vasileva.
Thank you. Thank you.
Great to see you.
Good movie. Today,
My happy for this project, amazing project, and I am extremely happy to be here. Thank you.
Yeah, hope to see you real soon again.
Thank you.
Well, good morning, everyone. Good to be back.
Bye.
It's amazing to see all the things that Rotarians do around the world, let alone in Biscayne. Since I got back, there's all these activities. I can't even keep a list of Peter's party and Ruben's and
Omar, he has to live.
music here and music there. So it's fabulous to be in Biscayne, the activities, and also to see everyone here.
Well, good to see you back. Joel? Hi, happy dollars with Gloria. Great to be here today with my friends and family is healthy. Great, thank you very much. I'm happy for the great work that Omar is doing with giving us great programs.
Good morning, my three happy dollars. The first one here for your event. The second one for the speaker, and the third one is for everyone to have a great weekend. I'm looking forward.
Happy dollars for the presentation, and as a longtime Chicago, and I can just tell, seeing Richard, it's really cold there, so I'm happy to be here. So my happy dollars go to also the presentation. It was very inspiring. My second happy dollar go also to Peter's event, and I'm happy to be there tomorrow and to help you. I think I have to sell tickets online. I wish I did. And the for the happy dollar, but for all the musicians, and I will be there on the second, and I would like to say something.
And thank you to Maren. She's provided a sponsor that's going to be serving beer for Romano.
Yeah.
Wow,
That's great. It's I think it's a Belgian beer, so we will have 18 liters, so gallons, 18 liters. So
We have one sponsor.
yeah. You have to. I just running late with my money.
Morning.
Morning.
Morning, Peter. So yeah, my happy dollars are with the bank. I'll reinforce the event on the 2nd that Gloria announced. I really hope you all can come. I'll also mention, I mean, Blair said all kinds of things happening. Yes, the Rapid Fire will be in town next week. If you have any difficulty finding their website or buying a ticket to their performances, call me. What an amazing program.
Yeah.
And I'm really inspired to see that our wine tasting event, Wine and Food Festival, is now really working as, I like this word that Ruben used, syndicate, right? A syndicate of clubs working for a project which, by all evidences, isn't just a nice place to send your money. It's getting results. I mean, they are really organized. I'm very impressed. So that makes me happy.
Toby.
Good morning, everyone. The first thing I want to talk about is the Lighthouse Run, which is on November 12th. You don't have to run, you can always walk. It's all right. It had, please, I register the Rotarians as a club. So if anybody wants to sign in, just pay you $35, get you a t-shirt, get your number, and come and join the runners. First, I will walk it. My happy dollars are with the bank. First, to the members that are coming back, welcome back. It's nice to see you again. To Myra, congratulations and continued success to you.
Thank you so much.
I know you will do beautifully and send the paperwork.
Okay.
And lastly, for the presentation, beautifully well done. Congratulations, you really are making a difference, impacting children and mothers and families and the whole country. Thank you so much for showing us what you're doing.
Madam President,
Let's go to the screen.
Ellen Lassie, PDG.
The Queen.
Thanks, Peter.
Let's
So
see
my happy
Wayne.
dollars are, of course, to see all of you here. And the presentation, Richard, excellent work. It's wonderful to see, particularly in Uganda. There are so many needs there. As you may or may not know, folks, we do some projects for malaria there as well. Also, I'd like to make the pledge for $100 towards your goal, Ruben. And my most happy dollar is because I will see you all face to face on November the 11th. So you better be at that meeting. I'm sorry I won't be able to come to the wine tasting itself because it's a very big birthday for me and my family wants me with them. So, and most of them can't drink wine. So I hope it goes very successfully and I look forward to seeing you all face to face on the 11th.
Excellent.
Okay.
Bob Brooks.
Yes, hi. Well, happy birthday, Ellen. It'll be wonderful. I have a happy dollar for a dynamo of a Rotarian, and that's Graciela Nearing. The project that she did just shouldered it completely. It was a surprise, and the effect and the faces of those kids really absolutely almost brought me to tears. So congratulations, Graciela, on your quiet but amazingly effective project. And also I have a congratulatory dollar for my trainee, if you will, Myra. Congratulations on jumping ship yet again successfully. Congratulations.
Bob. Dr. Ortiz.
Good morning. I have 3 happy dollars actually from last week that we didn't get to go to. So the first one is for the Nearings. They did an amazing job with the donation of the toys to the children that will affect their lives forever, I'm sure. The second is for the Uganda project, which to me also makes me want to like just close my office and go volunteer over there. It's just so amazing. And and then the third one is for both Ruben and Peter, that they have given so much of their time to help organize events that are going to make a lot of people happy on the key, that will bring a lot of joy to the participants, and at the same time are raising funds for very worthy charities. So again, thank you.
The speaker, would you like to say anything?
Happy? Why are you happy?
Oh, I would just say, I couldn't be happier to be working with all of you, and thank you so much for your partnership. But I also want to say it's unbelievably impressive to see the many different ways that you're engaged in multiple communities. And I second that the work of providing toys to those children was also just incredibly moving. And I'm grateful to all of you for that. Thank you.
And you haven't seen the other projects.
I know, I would love to. I'll have to see more. Thank you.
Right. Jonathan?
Well, first, one happy dollar to our speaker. Thanks for letting us know we can contribute to a project like that. Second, Peter and Ruben project. And the third one for Graciela and Pamela for those kids in
Inés
and Inés.
Romano was also-
Oh, and
Okay. And one more, I'll go by and give it to Gloria. One more for Omar. The website is a full-time job. And I'm amazed he's keeping up with that. So thank you.
First of all, to the Uganda project, because it's inspiring and it's effective, and it's hitting the money with money where it's needed. The second one for tomorrow's your event. Hope everybody goes like Toby today with a dress up for the meeting.
I'm
Tomorrow.
dressed up already.
Yeah, well. We should dress up in customs. And the third one is for the program committee that yesterday with our first meeting in the year to program next year. Therefore, we have practically full this year and next year, thanks to the meeting, the people working in this committee. Hats off for them because yesterday we put the house in order for the rest of next year.
And, your last but not least, so my $3 are in the bank, and I gotta tell you, I'm so proud to be part of this club. I traveled to clubs all over the world, actually, and when you come back home and see the participation of each one of you and what you do to contribute to our projects is phenomenal, and the number of lives that this club touches is phenomenal. So I'm so proud of that. Graciela, oh my goodness, how touching to have your project, and Michael, what goes on down there. Our speaker, Ruben, and Inez is not here. All of you are involved with some things as well. And I mean, I could go on, but anyway, that's it. Your turn.
Well, I'm gonna give $20 happy because I'm not gonna be here for the next 2 meetings. You're gonna miss me, I'm sure, but I'll be on Zoom. I have been called to duty for my grandchildren, so I have to go to Vienna. This has been an amazing meeting. This presentation of this project is incredible. The program to the Dominican Republic. I mean, when you see a need, that's what I love Rotary so much. When any one of these members see a need and they take the initiative and bring it here, we'll make it happen. It can be small, it can be big, but we'll make it happen. And that's what I want you to know. That's what Rotary is all about. Rotary is not only us, it's a million Rotarians out there that you can reach out and then transform one life at a time. And that's what we are here in this world to do, because it's not gonna be long.
Thank you for that. Banker and Ellen Glass as well with their project, amazing.
Yeah, so enjoy the music with sorry, I'm not gonna be here because it's beautiful. I have done it before. And really, really thank you to all of you. And the 4-way test. Who is going to do the 4-way test? Cecilia, you will do the 4-way test. Since you're here. The 4-way test of the things that we think, say, or do. First, is second, it's third, Four.
Will it be fun?
Always
So
fun.
sorry I can't be there for the Halloween party.
Thank you, Richard, for that very nice presentation. Hey, Patricia, when you take attendance, we had 6 more visitors behind me. Say hi to my girls.